Skin tightening treatments have become ever more popular, and I'm so pleased to see it because there's no one tool that does everything, and when we try and address too much with just injectables, we don't get the best natural looking results, whereas combining injectables with skin tightening can really give us some magic. Now, radiofrequency microneedling is a treatment category that many people have talked about, and we talk about it with many different devices like the Morpheus 8 or the Intracell or the Profound RF. These are all different types of microneedling radiofrequency technology. You might have heard of microneedling, and it's the principle of mechanically introducing tiny needles into the skin. The first manifestation of this was with a derma roller, and now most people are using more sophisticated microneedling pens which deliver the needles into the skin at varying depths. Radiofrequency microneedling takes that a step further. So the needles are introduced through the skin, and then through the tips of the needle, radiofrequency energy is transmitted. Radiofrequency energy heats the skin, and when we do it on the surface, we're usually aiming to treat to between 40 and 50 degrees, depending on what we're aiming to do, whether it's skin tightening or fat loss. Now, when we're using radiofrequency microneedling, that energy and that heat is transmitted beneath the surface of the skin to where it needs to be to stimulate collagen production, which is really what we're trying to do when we're tightening skin. In my clinics, we have a device called the Profound RF, which in my opinion is the gold standard of radiofrequency microneedling devices. It can deliver the energy to a depth of nearly 7 millimeters, and it delivers it for a duration that is 4 seconds, so much longer than other devices which are available, meaning we can get really tangible results, particularly through the lower face and the neck, which on clinical studies have been shown to be equivalent to about a third of a surgical facelift. But there are other great radiofrequency microneedling devices available, and Morpheus 8 is a particular favourite, and that's one that has huge benefits and can be used all over the face, including around the eye. So, as I said about injectables versus devices, there's no one tool that can do everything, and that's the same with devices. Other machines which I really like for skin tightening include the Softwave, which is a form of ultrasound device. Very different from other ultrasound devices like Ultherapy, which you might have heard of. It uses the ultrasound in a completely different way, creating parallel cylinders of thermal injury within the skin, having heated your skin to between 60 and 70 degrees. So quite significant. And that can be great to use all over the face and neck. It has the huge advantage of having no downtime, whereas radiofrequency microneedling treatments do carry some downtime. That's usually very manageable for most people, but it is something we need to plan into our lives, whereas with Softwave there's no need to factor in bruising or swelling. Neogen plasma is another type of skin tightening treatment which has recently come into the limelight after Shirley Ballas was treated with really beautiful results, and this uses nitrogen plasma to stimulate contraction of the fibres of the skin and give a tightening. These are all really elegant, clinically proven devices which can deliver great results. In my opinion, if I were you and I were a patient thinking about having a skin tightening treatment, don't focus too much on exactly which device you're looking for. Focus on finding a practitioner who you trust to have chosen clinically proven and effective technologies, and put yourself in their hands. For example, if I think a patient who comes to see me would benefit more from a device that I don't have, I'm very happy to cross-refer to someone who does have it. Because with the best will in the world, for clinic owners, these devices are big investments, and we can't possibly have every single device in our cupboard just in case someone needs it. We'll often work more collaboratively with other colleagues as well to make sure that our patients have the best results.
If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.